I really do think the key to good care as we get older is constant, ongoing communication with your doctor, be they a geriatrician or another form of primary care doctor, about what you want, how aggressive you want, that trade-off between things that might possibly prolong your life versus side effects and quality of life.
Hello, and welcome to Not Born Yesterday, a podcast dedicated to older adults and the challenges and joys of aging. Not Born Yesterday is about playing, working, loving, laughing, and enjoying the possibilities and opportunities of later years. I'm Miriam Goodman, your co-host. Not Born Yesterday examines the problems and solutions of growing older today. We bring you the wisdom and voices of experts in the field of aging and offer tips on how to feel your best, use your lifetime skills and experience, and make the coming months and years as fulfilling as possible. Along the way, we hope you will share your thoughts and concerns about being older and let us know how we can help.
Hello, I'm your co-host, Lynn Winter-Gross. Not Born Yesterday is brought to you by Next Village SF. Next Village SF is a local nonprofit providing older adults in the Northeast neighborhood of San Francisco with support to help age in place, as well as offering cultural, educational, and social activities that keep people connected and engaged with the community and with each other.
Today we're talking about health and where to get the most appropriate care as we age. Our guest is a geriatrician, Dr. Jay Luxenberg. Before we introduce him, here's a definition of a geriatrician. Geriatricians are primary care doctors who have additional training in treating older adults, especially those 65 and over. People over 65 often have multiple or complex health matters and need specialized care. Geriatric doctors have the training and experience needed to address these issues. They have the same training as regular primary care doctors, with usually 1 or 2 years extra of specialized geriatric education and training. They also pay more attention to your overall quality of life and goals. Their consultations usually take longer because they take the time and care to address any and all issues you may have. They'll also likely collect more information like lifestyle, family, and other community-related questions to get a fuller picture of your life. Dr. Jay Luxenberg is a geriatrician in San Francisco and Chief Medical Officer of Unlock, an all-inclusive care organization providing services everything from dental to arthritis in San Francisco. Dr. Luxenberg, welcome to Not Born Yesterday.
Thank you very much. I'm happy to be here.
So my first question is there a certain age when someone decides they need a geriatrician? Should everyone who's over 65 or whatever automatically switch doctors as they age?
You know, it's possible that everybody over 65 would want to, but there simply aren't enough geriatricians. And the current training efforts in geriatrics are not to produce enough geriatricians, even to take care of everybody that's over 85. So I don't think I'm over 65 and I don't have a geriatrician, and I'm okay with that.
Why aren't there more?
Oh boy, I could go into a million reasons. It takes longer to take care of an older person than a younger person. It takes longer physically to get people onto an exam table and help them take their clothes off and do the things that we need to do as part of a medical exam. But Medicare pays exactly the same for an office visit. They don't recognize geriatrics as a specialty. And I know I shouldn't say that. They don't pay any more for a geriatric specialist than they would for any primary care doctor. And so it's not attractive. It's not attractive to these young medical school graduates who are graduating with enormous loans to go into geriatrics. Only people that are really attracted to the field with a passion are willing to sacrifice economically to go into this field.
Are geriatricians usually more up-to-date on the latest research and tools for older patients?
So the answer to your question is not all geriatricians are up-to-date. Just like any doctor, you have to evaluate how how comfortable you are with them keeping up to date. I will say that people that remain board certified in geriatrics have to pass a test every 10 years. And so to me, people that are passing that test every 10 years are going to be up to date.
So tell me about some reasons that people might decide to choose to go to a geriatrician. What kinds of issues might they be having that they would want a specialist?
Well, there are certain diseases that were syndromes that are associated with age, and geriatricians become expert at managing them. And for that reason, sometimes geriatricians take care of younger people. So, for example, when I was doing research on Alzheimer's many years ago, we followed certain families that had familial Alzheimer's disease. And some of them were developing severe dementia in their 40s. And they had, because of that familial pattern, had parents. They knew what was in store for them. And so they sought out geriatricians who would help them basically stay at home as long as possible and get the help that they needed. And they felt that the average doctor just simply wasn't familiar enough with dementia to be able to do a good job of that. So subsequently, I've seen people with several dementing illnesses of early onset, even though they weren't 65, seek out geriatricians.
Are there certain issues that might pop up with a person, like multiple medications that confuse them, or mobility, things like that, that an aging patient really does need a geriatrician?
Let's talk about what you mean by do they need a geriatrician? Because geriatricians can serve one of two major functions. One is to be your primary care doctor and coordinate your care with other specialists if necessary. And the other is to serve as a consultant. And so it wasn't uncommon when I had a private practice for local doctors to send me a patient to do a consult, to give them advice to the doctor of how they should be managing this complicated situation. And that might include reviewing all the medications and making recommendations as to what could be safely stopped and what might be contributing to confusion, et cetera. But certainly, as a field, I think geriatricians are good at what we call deprescribing. That is, looking at a list of medicines that you're taking and say, oh my goodness, the possibility of interactions between all those medicines is enormous. It's confusing. You're being asked to take one pill every other day, one pill 3 times a day, one pill at bedtime. And we really do a good job simplifying that and eliminating things that aren't really, really necessary.
Is there a hesitancy among general doctors, among internists, to refer people to a geriatrician?
Well, I can tell you from my experience years ago, because I haven't been in private practice since 1996, so it's been a while. Some of them were afraid that I would steal the patient, that the patient would want me to be their primary care doctor and would leave the practice of the other doctor. And as you might imagine, essentially as independent business folks, these doctors don't like to lose patients. So there was some fear in that respect. But really, if you want to keep doing this successfully, you have to really discipline yourself that if somebody's sending you a patient as a consult, you don't take that patient as your primary care patient, even if they ask you to. Because if you do, you'll get a reputation for stealing patients, and pretty soon nobody will send you patients.
I've read that about 80% of older people have a chronic disease of some kind. And again, we've said there are just too few geriatricians for that. But what kind of chronic diseases would really yell or scream out at someone and say, yes, that's what you need, a geriatrician?
Honestly, most chronic diseases independently don't need a geriatrician. Let's think of the common ones. Osteoarthritis. So pretty much everybody has osteoarthritis by the time they're in their 60s. I can assure you that if we took an x-ray of your neck or your hands. You find it almost ubiquitous. And yet everybody with a little arthritis doesn't need a geriatrician. Changes in our sensory system, so visual changes and hearing changes. If you only have one of those, you don't really need a geriatrician. Where geriatricians become, in my opinion, really useful is if your chronic illness is a little bit of this, a little bit of that. In other words, you have arthritis, you have some mobility problems, you have some dizziness, you have some sleep problems, you have some constipation. Those are the people that end up on a million different drugs. And the geriatrician really is good at focusing on what's impairing your function and really trying to convince you that taking 15 different drugs is not a good idea and helps you simplify that. So it's not the presence of a chronic illness, but the presence of multiple chronic illnesses that really screams for a geriatrician's attention.
What about palliative and end-of-life care?
Well, I'm glad you asked that. I love palliative care, and a friend of mine here in San Francisco has started a dual training program in palliative medicine and geriatrics, which I believe they conveniently call GeriPal. But many doctors who are specialists in palliative medicine really concentrate on a hospital practice and are not managing people on an ongoing basis. So I find palliative medicine and geriatrics often works in complement. A person gets admitted to a hospital, it becomes recognized by the doctors in the hospital. And pardon me using the term doctors, it's often also nurse practitioners and nurses and social workers. Somebody notices that really this person needs clarity in their end-of-life wishes to avoid having things done to them that they simply wouldn't want done if they could communicate that properly. Most people want comfort toward the end of their life, and they don't want to spend a lot of time in the hospital, and they don't want to be going back and forth from the hospital to a home or a nursing home. And so clarity of these goals gets recognized in the hospital, and they call in a palliative medicine consult. And the palliative medicine doctor or a team that's associated with the palliative medicine doctor come up with a series of recommendations that might include hospice, but it often doesn't. But they try to clarify what your end-of-life care wishes are, what your priorities are. And then a geriatrician can help you implement those once you go home, either as a consultant or by taking over your care.
Is there anything else you think our listeners should know about a geriatrician and when they might want to consult one or ask their doctors to consult one?
You know, the very nature of the older population in the US means there's a disproportionate number of immigrants that are monolingual in a non-English language, or they're multilingual, but they don't speak English. And it is possible to find geriatricians that speak your language, essentially whatever that language is in the US. Sometimes it helps to consult with the American Geriatric Society, which maintains a registry, and they can give you local consultants who are taking new patients or seeing people. And I do think to get a good communication for your preferences, it really helps to have somebody that speaks your language as opposed to trying to work through a translator. And I think the worst circumstance is like your family member is serving as a translator. That should be avoided whenever possible because it conflates a lot of emotion. And sometimes what you end up with is the wishes of the family member, not the wishes of the older person themselves. So I really do think the key to good care as we get older is constant ongoing communication with your doctor, be they a geriatrician or another form of primary care doctor, about what you want, how aggressive you want, that trade-off between things that might possibly prolong your life versus side effects and quality of life. And, we all differ. And, some people would tolerate the worst chemotherapy in the world if it could prolong their life by a few months or even a few weeks. But other people truly believe very differently. And that communication is the key to good care.
Oh, well, thank you so much, Doctor, for all this information. I know we all learned a lot today. It was great having you on Not Born Yesterday.
Thanks so much.
That was Dr. Jay Luxenberg.
Because we like to give our listeners news they can use, today we want to share the latest technologies specifically designed for seniors. Usually known as smart technology, there are hundreds of new devices originally created for older adults, but of use to anyone of any age. These devices go way beyond the medical alert bracelet. With smart home security, one can see who's at the door, whether an appliance like an oven was left on, or make sure that the door is locked without physically going there. While some of these smart devices can cost a bit, it will seem worth it if you or a parent has fallen and can't get up.
Smart wearable devices are not just for trendy youngsters. In fact, they encourage independent living. Most track your blood pressure, heart rate, and whether you have fallen. A friend of mine swears that her smartwatch is a lifesaver. When she fell recently in a dark garage, a live operator called her and asked her if she needed an ambulance. She said, "No, just call my neighbor and wake him up and he'll help me get up." That worked for her, and she was so excited about it she bought smartwatches for all her children and grandchildren. Another starter device you might consider is a connected pill dispenser. You don't have to be elderly to forget to take your pills, and these devices have sensors in each pill drawer, so it can tell you if you forgot and remind you when it's time for the next one. Some of the devices connect to smartphones or computers. It can also be connected to family members so they know who took the pills on time. So go ahead and investigate these smart devices. And if you think you might have trouble installing one, Next Village SF has young volunteers who can set you up easily.
That's our podcast for today. Our thanks to Dr. Jay Luxenberg for his insights and information. Our theme music is by Hook Sounds. You can learn more about Next Village SF by going to their website at nextvillagesf.org.
And thanks to you for listening. We would love to hear what you would like us to discover and discuss. Please contact us at notbornyesterdaypodcast@nextvillagesf.org.
Be well, stay strong, and remember, you weren't born yesterday. I'm Lynn Winter Gross.
And I'm Miriam Goodman.